So let's start. What is Suisselle Cell Booster Lift? Well, lift is a combination of active principles. Is mainly is a hyaluronic acid. So 18 ml, 18 milligrams of hyaluronic acid, not cross-linked hyaluronic acid, worked with shock technology, so linked in a physical way, not a chemical way, with amino acids, specific vitamins that provide a activation of the product of collagen and matrix fibers. So the composition is B complex, vitamin C, vitamin E, and biotin. The specific amino acids are arginine, glycine, lysine, proline, and valine. So, all amino acids that works on the building of collagen and fibers. And the vitamins help to protect the cell from free radicals. As everyone knows, an inflamed environment, the ROS, the reactive species of the oxygen, are painful, are dangerous for cells and for the environment where the cells that we are dedicated to, where we dedicate our work. If they work on an oxidative environment, they will not work very well. And so the antioxidant effect of vitamins is crucial. Amino acids complex, as we have said, as we have told, is specific combined for to give the cells, to give the fibroblasts the substrate to work and produce collagen. And in particular, vitamin B2, riboflavin, plays an extremely important role in the maintenance of the healthy and glowing skin. My previous webinar was focused on this protocol that we call it Venus without collier. So it means that in Italy we call the necklace collane di Venere, called Venus collier. So today, thanks to Cell Booster Lift, that is so effective on the neck aging. Venus would be without collier, because I love lift on face, but I tried to work it specifically on the neck, and I developed a precise protocol then I will show you. Now we see the shock technology. Here is very clear how the hyaluronic acid is shear deformation. So the hyaluronic acid is posed under a precise pressure, and in the meantime that this pressure works on the hyaluronic acid molecule, the link inside of the molecule of hyaluronic acid just break momentarily for a moment, and this is when the vitamins and amino acids gets linked inside the molecule of hyaluronic acid. So at the end of the procedure, we can provide to the skin a hyaluronic acid that is more focused on the skin, on the drug delivery, on the prolong the bioavailability of vitamin and amino acid. And this is the crucial difference between the Cell Booster line and all the other biorevitalizing, because everything that is not cross-linked, I mean chemically cross-linked with BDDE, that you inject and it lasts in the tissue for 12, 18, maybe sometime 24 hours, but then the hyaluronic acid will be degraded by the hyaluronidase, the endogenous hyaluronidase. In this way, this shock technology prolong the life of hyaluronic acid, and most important thing is that prolong the release of the vitamin and amino acid, and this is the real difference with all the other products on market. And that's not why I tell it, because I will show you some results that are completely impossible to achieve with other devices. So that's what we just said. So the shock technology stabilize the nutrients for target effect, and and provide a sequential release for long-lasting effect, and also facilitate the intracellular delivery for a better efficacy. Here is a fast slide that describes the intracellular process of collagen production. We know that the main amino acids that the collagen is built are lysine, proline, and glycine. Then we got the three step of production, so pro-collagen, pre-pro-collagen, and so long. And the final molecule is a triple helix of fibers that is very strong, very hard, and very difficult to produce by the how to say, very easy to produce by the fibroblast, but is the most important fiber protein of the matrix. So our fibroblasts are naturally ready to produce it. What we do is to give them feed them in some kind of way, to feed the fibroblasts with the amino acids, and also put them in a more favorable environment with hyaluronic acid and with vitamins. Now, this is a very important slide to me, because some people could say, yes, but there are many other principles that stimulate the production of collagen. Let's distinguish between fibrosis and collagenogenesis. It's very different, because with the product that we know very well as polylactic acid and so long, what we stimulate is not collagenogenesis, it's fibrosis. Fibrosis is a paraphysiological phenomenon, not a physiological phenomenon. And the difference, when you will see my cases, you will see that the difference between a treatment with calcium hydroxyapatite or polylactic acid and the treatment with cell booster line is huge. We know that fibrosis reduce the elasticity of the tissue. It's true that the thickness of the tissue improve, but not in a physiological way. So fibrosis is a pathological or paraphysiological repair response, and in a very disorganized collagen in the ACM. So it's not a physiological growing of the skin, but is a kind of repairing after a damage. So when we need it, just before the choice of the surgery, so when we are last stage of aging, we can decide to use the collagen boosters like polylactic acid, but it must be to me, in my opinion, it must be a very extreme choice. And I will show you that also in patients 70, 71 years old patient, we can still choose to stimulate collagenesis with the cell boosters, but not because I tell you, because I will show you. And so natural collagenesis is a controlled process in which fibroblasts produce and organize collagen for normal tissue maintenance, and repair it depends on healthy fibroblasts. So what we bring to the skin with fibrosis: firmness and irregular texture, unnatural contour change, higher risk in predisposed patients. Of course, we know that these collagen booster are effective, but are quite risky. I didn't register, only one time I registered a side effect of granuloma, but we know that literature reports many cases of granuloma, many cases of sterile cysts that are not easy to treat. Instead, with the collagenesis that the cell booster provide, we can dramatically improve the skin quality with natural results, predictable outcomes, and not any severe side effect. Nothing. I never registered anything more than ecchymosis. But if you follow the webinar, you will see that also there is a specific plan of injection, well, where also the ecchymosis is very reduced. Okay. This is the venous without collier protocol. So we see clear result in horizontal neck lines, decrease of elasticity and dermal dehydration, also in creepy skin appearance. Is designed to improve all these imperfections. The indication we just told, the ideal patient is 35 to 65, but this doesn't mean that you cannot work on the 70 years old patient. I had many results on the 70 years old women on the neck. Of course, it's not maybe the best that you can achieve as result, but you always achieve results. If to the 60, 65 years old, you can hope to achieve the 100% of the potential of the treatment, on a 70 years old woman, you can hope to achieve the 75%, but it doesn't mean that it doesn't work. It works the same. Of course, we can't expect the crucial, the dramatic effect of that we can expect on a 50 years old woman. True, there are not particular contraindications to the treatment because only on active skin infections, herpes, autoimmune diseases, but in a severe, in an active mode, pregnancy, of course, and I would inject the cell booster on the same area where in the last 10, 15 days I injected something else. The protocol preview 3 sessions of cell booster lips and 1 entire vial, so 3 ml per session, spaced 2 or 3 weeks spaced, also 3 weeks, no problem, we don't lose anything. And maintenance, we can make a session every, maybe 6 months is too long time, every 3-4 months. 4 months is the best. And the neck should be treated with a skin quality approach, not with a volumized intent. Of course, we have seen in the last years the treating of the neck with cross-linked hyaluronic acid is not the best. We saw many cysts and small balls lasting for weeks after the procedure. So it's better we don't work with the cross-linked HA on neck. The homogeneous distribution is quite essential, and the intradermal precision is critical. That's a very important point. When we inject, we have to stay superficial. We have to break the corneum, the stratum corneum, and try to inject as near and as next that we can to the dermal epidermal junction. So we don't need a depth. We forget to ask how many millimeters. We are speaking about microns, not millimeters. When with the point of the needle, when we feel that we break the stratum corneal and the epidermal stratum, we have to inject there. So we have to see the blanching. We have to see the white papule when we inject. Don't worry. If you see the white papule, you're in the right plan because it will last for 1 hour, 1 hour and a half, no longer than this, but we will be exactly at target. And if we inject so superficial, we don't cause ecchymosis to the patients because we compress, we push the capillary plexus, the capillary, and we don't break it, okay? We don't cross the vessels. We push the vessel down, and that's why you see the white papule, okay? In this way, you can make also 150 injection. The patient will not feel any pain and will not will not cause any bruises. So you can mark exactly where you want to inject first. And then, as you see in the graphic here, is very clear. If the violet line is the epidermis and the pink stratum is the dermis, you have to inject between the epidermis and the dermis. So as superficial as you can. So micropapular technique. Best is with a 32 needle gauge because it's more thin, subtle, and also the point is very thin, and it helps us to stay as superficial as possible. You can inject with 4 millimeters, or if you got a particular sensibility, you can also use the 12 millimeters because maybe it helps, is more elastic. So it helps to better understand, to better stay superficial. But if you want to stay more comfortable, use the 4 millimeters. The 3 ml syringe, to 2.5, 3 ml syringe. And the product in this case, it's only Cell Booster Lift. So not other, after in the other slides, after we will see the combination of lift and shape. But for the moment, the Venus without collier is a protocol developed only for lift. So approximately inject 0.02, 0.05 per point, and with a very subtle angle, and maintain an interpoint distance of about 1 centimeter, but also less. We got a lot of product because 3 ml, you will see that 3 ml will be quite a lot for the neck, so we can also short a little bit the spacing of the injections. Try to make a more uniform as possible pattern of micropipules, and keep inside the wrinkles, inside the necklace for the 70% of the vial, and go between the wrinkles for the remaining 30% of the product. Now, I will also show you a video about the injection. So after the procedure, of course, gently massage to help the papule to stretch, but also if you don't, they will stretch the same, and the papule will not remain longer than, I think, 1 hour. Yes, 1 hour and a half. And of course, the typical post-treatment care, avoid intense physical activity for 24 hours. Always use the sunscreen. Always, also if you don't inject anything, the patient always have to use it. Expected reaction is a mild erythema, but very short. The erythema can last for 3, 4 hours, not longer. Sorry. And temporary micropapules. Then repeat every 2, 3 weeks. As I told you, the 3 week space is okay. Don't worry, you won't lose any result. And this is the first results that I already show with the protocol. And this is a video how to exactly what I exactly mean with superficial injection. We mark the points where we want to inject inside for first inside the necklace and then in the spaces between. It's very fast as you see. Can you see how superficial I am? I inject under the epidermis, not deeper than that. Also, one more tip is to inject compressing the platysma bands. If you inject compressing the platysma bands, you also will achieve a quite myomodulation of the hyperactivity of the platysma. And that's it. 1.5 for half neck, and then we will use the other half vial for the other side. Don't forget, of course, to careful disinfect because is documented that almost 100% of infection after aesthetic medicine procedure are because of the not of a problem of disinfection before the treatment. So it's so easy, just do it. And so the point of injection, the plan of injection, we already said, is epidermal. Not in the hypodermis. You can also use it in the dermis. The only thing that you will lose if you inject in the dermis is the stretching effect on the wrinkle, because treating the wrinkle, injecting on the epidermis, you know that the skin in the neck is very thin, is very subtle. So the stretching effect of the injection on the dermal epidermal junction, it's very important, it's crucial for the outcome. So if you will inject inside the dermis, you will of course achieve some results, but not the best that you can. Okay. Here, in fact, what I just told you is exactly this, that dermis and epidermis are very connected, and all the skin layers are very connected. This very important review about the interplay between the cell surface receptors and extracellular matrix in the skin speaks exactly about this. So these important authors in the first line of the abstract say skin consists of the epidermis and dermis, which are connected by specialized basement. They use the word connected. They could use divided, but they choose connected because if they are anatomically divided, are physiologically very connected, and that's why they used this word. So what is important injected in the epidermis, as I told you, is the achievement of the improvement caused by the stretching of the epidermis and the stretching of the dermal epidermal junction. That is another way to stimulate the rejuvenation of the dermal epidermal junction. So if you will inject under the junction in the dermis, of course you will achieve something, but maybe not the best that you could. Here is first, no, this is the patient that I show the last time. As you see, 3 treatment. She's a 60 years old, 58 or 60, yes, 58 years old woman, treated with 3 sessions every 15 days, and the results are amazing. You see, we improved the depth and the homogeneity. We improved the skin quality, the texture, and also the skin thickness, if you see. But today I will show you also better things. Okay, now we see the combination of the two products. So the combination of Cell Booster Lift and Cell Booster Shape. Cell Booster Lift is a device designed for the dermis and the epidermis. Cell Booster Shape instead is a device, it also made with the shock technology. So it also provide a prolonged bioavailability of the active principle. And in the case of Cell Booster Shape, the active principles is vitamin C and carnitine. And why? Now we see. Because the carnitine is documented that carnitine can improve the beta oxidation of the fatty acid locally. So vitamin C and to bring a fat oxidation during the exercise. Sorry. Yeah, the vitamin C that help the antioxidant effect of the that provide an antioxidant effect and improve the synthesis of carnitine and and the carnitine improve the transportation system inside the mitochondria. So also improve the oxidation of the fat. And that's why we use it in a deeper layer, because for the jowl bag or for the heaviness that we often register just above the ligament, the important ligaments of the face. So sometimes we find some heaviness on the above the nasolabial fold, or we see that the action of the depressor anguliori and the marionette lines are also caused by the deposition of fat on the ligament. So these are all target for Cell Booster Shape. So specifically jaw bag and the upper part of the marionette lines and the upper part of the nasolabial fold. But today we will speak about the lower third, okay? So it's effective also on the fat and also on the edema. So all this kind of aging that results in a squared shape of the mandible is the correct indication of Cell Booster Shape. The first case is a very young man. He's a 35 years old man, where we treated the double chin, for example. In a 35-year-old man, we can't speak about laxity. Of course, there is not laxity on this subject, so we only have to fight with a genetical conformation of the double chin, and we achieved a good result. You see how the heaviness of the double chin is reduced. This image are after only 2 sessions, so we still miss the result in the third session, but I already see something. I already registered a reduction, so I want you to show you. And here we see the volumetric analysis with the Vectra, the color by distance, and that's how we reduced dramatically reduced the volume in all the lower face and the double chin with the cell booster. And so here you see the vectorial analysis of the migration of the tissues, and we see how the tissue just lift, because if you if you take away the heaviness under the double chin and between and in the jaw bag, of course this patient wanted to desire, he desired a kind of lifting of the lower face that was too heavy for him, and so we achieved it. This is the other side. Okay, injection protocol of cell booster shape. This time we need a 12-13 millimeters gauge. The perfect to me is the 30 gauge, because here we have to inject bolus of about 0.2 ml. So the 32 gauge risk to be very slow, too slow and boring also for the patient. So being in the fat is not a painful treatment. So the fat has not a receptor for the pain. So we don't have to worry to be painful. And so we can use the 30 gauge with no problem. We should inject at about, we should enter about the half of the needle. So 6-7 millimeters. You can also use 8 millimeters needle if you find it, if you have it. In that case, you can inject all the needle. And so we have to keep in the fat, not very next to the bone, and not even more superficial, because we have to target exactly the fat compartment. Oh, the sessions. To be honest, in this case, I always prefer the 4 sessions treatment, because the 3 sessions is not always totally satisfying. So it's better you prepare the patient to make 4 sessions. And I made an outcome assessment with Vectra, the Canfield Vectra. That is the device that I use in my daily practice, not in the university. In the University of Sapienza, we have a research center with VISIA CR, LC, OCT, OCT, confocal microscopy, all the best not invasive imaging devices that I really love, but these data are made in my clinical private practice, so I document it with Vectra. The injection volume, it's about 70 injection point, 0.2. So it's about 1.4, 1.5 ml per side. So it's very easy to stay in the indication. And for double chin, specifically for double chin, we can inject a total of 7 point, random add on double chin, 0.4 for point. Here the first patient, she's a quite young woman, but as you see, she suffered a sort of hypertrophic aging, and this is a 3-session protocol, not 4, but is a combination protocol. So shape on the jaw bag and neck, and shape on the jaw bag and lift specifically on the neck with the Venus without collier protocol. Here you see very clear the dramatic rejuvenation of the neck and the face. Here you see the improvement on the firmness of the neck, and in particular of double chin. Here again. And I want to tell you that I didn't select my best cases to make this webinar. I showed everything that I had. I prepared it 15 days ago. So everything that I had 15 days ago. So I didn't find myself to choose where this protocol worked better. Everything is the best. So everywhere you use it, you achieve result. So I didn't make a selection on what to show today. I show everything because it works in any case. I, I cannot tell it in absolute, but on my practice, it worked on every subject where I injected. Here you see the very beautiful vectorial analysis of you see all the mandible area that lifted, and the movement of the vectors are below, because as I told you, this is a protocol specifically designed to reduce the heaviness, to reduce the squareness of the lower face. And see what happened on this neck. Incredible. The reduction of here we didn't achieve, but also for the other subject, we didn't only achieve a reduction of wrinkles. We achieved a total lifting of the neck and a reduction. You see what the improvement in the firmness of the double chin and the platysma bands. Lovely. So the treatment of jaw bag frequently improved the double chin because often if we inject in the jaw bag, the gravity naturally brings spread the product also in the double chin. So if we don't have a very severe grade of double chin, we can also choose to only treat the jaw bag, and the improvement in double chin will be subsequential. So 12, 13 millimeters needles, you inject for half of the needle, and you release 0.2 ml for 7 points per side inside the jaw bag. Every 2 weeks. In this case, I suggest to stay more short, more in the 2 weeks than in the 3. And for 3-4 sessions, what I suggest is more 4 sessions, more than 3. This is another case. This is a 70 years old woman, 70. And look what happened with 3 sessions. The wrinkles, the necklace are reduced, I think, for about 75-80%. The platysma band reduced, and as you see, also the tone of all the skin of the neck is improved. I really hope to have other chance to show you how this patient improve again and again, because now we made another one session, and I made an assessment last week, and she improved even more than this. So I would like to have the occasion to show you more. Here she's also a 7. I can't see the slide, but I think I can't read properly, but I think it's about 60 years old woman. And here also we treated the jaw bag and the neck. It's exactly the same protocol of before. And you see, look in this view, how you already see the reduction of the platysma bands. And consider, if you want to put the 6 to 10 units of botulinum toxin inside the vial and and inject the first session, including a microbotox, you can do that. No problem. I didn't, because I wanted to test only only the effect of cell booster lift alone with the shape. But if you want to associate one session, in one of these sessions, some small amount of botulinum toxin, you can do that. It's documented, no problem. Here on the other side, same effect, reduction of the platysma bands, a dramatic improvement of the necklace, and a nice improvement of the jowl bag. Here, this is the color by distance analysis. So you see all the orange and the yellow is about is negative volume, so reduction of heaviness. And this, oh, here we help a little bit with the filler on the malar region to help the result. You also can combine with filler, no problem. But today we speak about the lower third. And here is the vector analysis. You see there is a complete and diffuse lifting of the skin. And this is the focus on neck, and you see is I think that describe this picture is not important because there is nothing to focus on. The rejuvenation and the improvement is so global on this neck that we don't need to explain longer. This is another case, and this is a unique combination of shape with filler and Botox. So you see Botox on the upper third, on the forehead and eyebrow, filler on the middle third, and treatment of the jowl bag and cheek on the jowl bag with shape. It's the result is beautiful, but I want to show you the volumetric effect. Here, you see how with the Botox on the forehead, we made a complete rejuvenation on the upper third. And we achieved an improvement of the tone with filler in the middle third. And we injected shape in the lower third to enhance the results that we achieved with the filler in the middle third. So very clear. Also here you see a dramatic reduction of the heaviness in the lower face. And here, helped with filler, of course, the lifting effect and the lifting vectors of designed by Vectra is even more clear. This is a 54 years old woman, and here the protocol is the shape and lift, so jawline and neck. And this is another case. I told you I didn't have to select cases. I just put it on everything I've done because it works on everyone. And this, I have to be honest, this is a patient from Milan, and I work in Milan 1 week a month. So the spacing between the session has been at least 3 weeks. So even working on a session every 3 weeks, we can achieve this beautiful result. She's a 68, I think, yeah, a 68 years old woman, and we treated with shape and lift 3 sessions. And of course, we are out of target, but the results are lovely the same. Here the volumetric, you see how the reduction of the jowl bag is still effective, because if we see here in all this orange area on the jowl bag, we've got about 2 millimeters of negative volumes. The vector, it's only here, I have to say, only thanks to a little amount of filler in the retromandibular angle. And this is the work of lift and shape on the neck. And you see also about 70 years old, we still achieve important results. The patient is, of course, very happy about the results, because as always, you don't only see the reduction of the wrinkles of the necklace, but you only see the the improvement of the firmness and complexively all the tone of the neck and the lower face. Lovely. She's very happy. I think she's the last case, even 60-something woman. Here we treated 3 sessions of shape on the jaw bag. This is a case of very extreme heaviness of the face and lift on neck. Look how the color of skin is changed, the, the, the platysma bands improved, and the tone of the skin completely changed. And here is the volumetric effect. Of course, we helped with some filler in the middle third, but the reduction of the fat department, in this case, also the reduction on of the prospicent below area not below, sorry, the upper area of the nasolabial fold. You see how we achieved reduction of the fat here and reduction of the heaviness. Can you see it? It's very clear, the reduction of the heaviness. And of course, we have to go ahead and work again and again with this case, but we already have good results on the face. And you see, the lifting effect is very clear and amazing results on the neck. And here also we're speaking about out of target woman, out of target age. So here is to prove you how it's not only about prevention, just like the other biorevitalizer, that you mostly work in prevention than in treatment. Here we speak about dramatic results. And as I repeat, I am showing every subject that I treated because I didn't have cases of no responders. Very young woman. This is a case of a 45 years old woman with 1 ml of filler on the malar area and 3 Botox and 3 sessions of jaw bag and neck. Look what happened. The heaviness of the jawline is very reduced. She was lovely also before, but then she asked to reduce. She came to me, asked to only reduce this irregularity of the jawline, and now she's very happy. So, cell booster line may be effective used as monotherapy approach in selective patients. If you and the main indication of the cell booster line is in monotherapy, but is not excluded also to combine and with other treatments. To be honest, what I do in my daily practice is use cell booster on every patient because I find indication of for a product of the line for almost every subject. And thank you for your time, and I'm ready for the question answering session. Nina?
Yes, please open the Q&A window.
Okay.
Tab by clicking on the plus tab.
Chat.
Okay. Questions here.
Maybe I have to stop the sharing. Ok, now I see it. Allora, Valerio Girone, ciao a tutti, grazie Valerio. Filippo Rigobello, che ago usi? Allora, I answer Nina with the Italian, sorry, with the Italian question, should I reply in Italian or in English?
Please reply in English. There are
Okay.
also
Both
five
of them.
questions
Okay.
in English in the Q&A
Ok,
tab. Can
allora
you see it?
Filippo,
It's not the
Filippo,
chat, but it's the Q&A tab.
oh, well, now I was reading the chat. Do we want to answer before to the chat and then to the Q and answer?
Yes, please, because there are
Ah,
some
ok, so
questions.
briefly, che ago uso è per il 32 gauge, so 32 gauge for the lift and 30 gauge with the shape. Si riescono a usare anche i Nanosoft? Sì, scelta eccellente. Of course, you can use Nanosoft with lift. It has no sense with shape because it would be totally out of target. So usa i Nanosoft per il lift, va benissimo ma non per lo shape, non avrebbe senso. How many ml each session? In tutti i casi che ho mostrato, all the subject that I showed, I used 3 ml for session of the lift as well as shape. 3 ml, so one vial. Riducendo il tessuto adiposo aumenta l'elassità cutanea? No, in nessun caso. In nessun caso riducendo il tessuto adiposo, aumenta la lassità cutanea. So there is no documented cases with this procedure of augmentation of the skin laxity with these devices because the skin laxity aumenta when you drive the cell in necrosis. Here we are not making necrosis. We are driving in an improvement of the fat of the activity, mitochondrial activity. So an improvement of the beta oxidation activity is not about necrosis. There is no necrosis, so there is absolutely no risk of skin laxity. Do you mix both lift and shape in one injection like a hybrid injection? No, of course not, because they have different target. Okay, the target of shape is fat compartment. The target of lift is dermal epidermal junction or papillary dermis. So it's a completely different mode of injection. Can you please tell about mixing cell booster shape with Botox? Yeah, no, not shape. Absolutely, no, it had no sense because we inject shape in the fat compartment and there is no muscle and there is no nerve in the fat compartment. So what I was telling is the mixing of a small amount of but for small amount I mean 6 to 10 units of Botox with the lift and then make hundred of papules of lift. So it's with lift, absolutely not with shape. No, don't do that. For nasolabial, do you use cannula? No. I always use needle because it's not a reticulated gel. It's liquid. It's not cross-linked. Sorry, it's not cross-linked, so it has no sense to use cannula. How do you treat smile line only with lift and shape without filler in the middle third, cheeks filler? Yes, you can. Of course, probably you won't achieve a perfect result, but you will achieve a 70-80% of result with a reduction of the jawline and an improvement of the skin of the lower third with lift. What about Cell Booster Glow? Cell Booster Glow will be subject of some other webinar. Today we speak about lift and shape. Anyway, Glow is more about a specific product to improve the clarity, to improve the bleaching, to improve the color. It's not specifically about the tone and the skin density. The density is more about lift. Giordano, grazie per le tip. Prego, Filippo. May I ask what combination you have encountered when using these products And do this product carry any risk of ischemia or tissue necrosis? No, not any. No necrosis because it's not sodium desoxycholate. So there is not risk of necrosis and no risk of ischemia because there is no BDDE inside. They are not reticulated gel. So forget about ischemia and necrosis. There is no risk. Is cell booster shape burning, painful when injecting? No, absolutely. The answer is absolutely not. Is using 1.5 cc of cell booster glow is enough for face treatment? No. If you want to provide a glow treatment, you have to inject 3 ml for session for a full face. Possono fare attività sportiva dopo il trattamento sia lift che shape? Non succede niente, è chiaro che noi raccomandiamo di non fare attività sportiva intensa almeno lo stesso giorno per una questione di contaminazione e così via. Ma poi che vuoi che ti dica? Non c'è alcun pericolo di migrazione, la possono fare. There is no video how you inject cell booster shape in patient to treat lower face. No, there is not. I will provide you in the next webinars, ok? Gli aghi sono forniti dalla confezione? No, there is no needle in the box. And I suggest to aspire the product with a 25 gauge needle, is very fast, and inject with a 32 for lift and a 30 for the shape. Cell booster shape increase metabolism of fat. Can we introduce it as fat rejuvenator, reconstructor? No, no. Or maybe yes. It's a very interesting question. Improve the quality of the skin tissue and reduce the hypertrophy of the fat. It could be. What is the effect injection shaping in fascia fat on healthy young individuals? Well, I think that if you don't have fat migration, if you don't have, yeah, these questions are very interesting, really very interesting. And thank you. I have to, I should study to understand and reply. But I think that we have the necessity of inject cell booster shape when we find the fat migration. I understand that your question is very theoretical, and I respect it, but I don't know what happened if I inject shape on a young patient with a tonic fat. It's a very interesting question, and I thank you to have posed it, but I don't have a clear and sure answer. Shape on arm and tummy. Of course, yes. Many colleagues do that. I don't because my treatments are always focused on face. I am more about face as a practitioner, as an injector. But I know of many colleagues that works it on the body, on arms, on the legs, everywhere it works. Of course, you have to plan to inject at least or to inject 2 vials for arm, or to plan some session more. But I know that it works very well. Could cell booster shape decrease fat aging? Yes, I think so. Il trattamento deve essere più intensivo in chi ha... Sì? Oh, Laura, sta facendo il webinar. Il trattamento deve essere più intensivo in chi ha già fatto sessioni di PLLA a calcio idrossiapatite? Good question. I translate. Should the treatment be more intense in a subject that already made session of polylactic acid or calcium hydroxyapatite? I don't think that should be more intensive. No. I think that we can achieve the same results. What concentration of botulinum toxin do you use in combination with cell booster? Okay, 6 to 10 units of international units. So something about 0.1 ml of 1 ml concentration of 50 units. What do you think? Use lift and shape with cannula recommended or not? Lift, no, not lift. Timur Taskesen do that, and he achieved results with that, but I don't, because specifically on the neck, I think that there is no cannula that can respect the correct layer of injection. Instead, shape can be injected in the fat with cannula. There is no problem. Many colleagues do that. Can inject shape on tummy and arm? Yeah, okay. Cell booster shape or double chin compare with eye bag. To be honest, I don't have experience of shape in eye bag, but for sure I have on double chin, and on double chin it works very well. Can we mix Botox and supposed to lift? Yes, so as already told you, how to mix the Botox in units. I told you 6 to 10 units. That is about 0.1 ml. Can cell booster lift and shape be used for the under eye area, eye bag or one? Yes, it can be. It has the indication, and you can try it. I didn't make cases, but maybe I will. But many colleagues do that with satisfaction. For nasolabial fold, would you prefer injecting the shape or the lift? And to what depth would you go? For nasolabial fold, I wouldn't inject lift or shape with a feeling intention because they don't feel. They don't feel. So what I would do is to inject to the upper. When you register, when you see a migration of the malar fat compartment on the nasolabial ligament, there is where you have to inject shape in the between the malar and the nasolabial fold to reduce this band of fat and reduce the heaviness of this area. So use shape with 3 points here, upper to the upper part of the nasolabial fold. 1, 2, 3 points, 0.2 ml, and in 4 sessions you will achieve a wonderful reopening of the nasolabial fold, and you will not need to feel it. We already spoke about eye bag. There are also recommendations for linear techniques for injecting cell booster lift and using a cannula on the face, but we cannot guarantee superficial administration. Do you use this technique? No, dear Olga, I don't. I only use it. Timur do that. My colleague that made the presentation with me the last time, but I don't. So I recommend to only use it with needle. But you can go on YouTube and look for Timur Taskesen webinar on cell booster lift, and you will find his cannula technique because the webinar is on YouTube. You can see it, and you will find the cannula injection technique of Timur, and I totally trust Timur. So I'm sure that also with cannula, if you learn how to do it by Timur, you will achieve excellent results. We love our colleague. And so now I have to open the question answering session, but I can't see it. Nina, can you please help me?
Please check on the plus
Ecco, here
arena.
it is. Okay, I found it. What makes cell booster lift and glow so different? Oh, I'll tell you. As explained, is the shock technology. So this technology of rebuilding of the molecule of hyaluronic acid with yeah, with amino acids and vitamins linked inside the molecule. How? With the shear stress. So the product Suisselle during the production of lift, shape, and all the cell booster, it's all the same technology. They put the molecule of hyaluronic acid under under pressure, specific pressure. With that pressure, the molecule of hyaluronic acid open the links. I don't know how to better tell it. And then they put the vitamins and amino acids. And when they reduce the pressure, these vitamins and amino acid complex remain linked inside the molecule, so that in the 15 days after the injection, the molecule of hyaluronic acid will be reabsorbed and will be prolonging, and this reabsorption will result in a prolonged bioavailability of the amino acid and vitamin complex. And this is the crucial difference between any other biorevitalizing that you can use it as a prevention of the aging, and the cell booster line that you can use as a treatment of the aging, okay? Is it only submental and jawline? No. To be honest, you can use Cell Booster Shape, that I think is the product you're speaking about, on the heaviness of the migration of the malar fat on the nasolabial fold, and also if the migration of the buccal fat on the jaw bag also cause a heaviness on the marionette line, you can also go to the part upper to the marionette line to reduce the heaviness. Then, how long does the swelling last after the booster glow injection? Please tell me about the post-treatment downtime. There is no downtime. 1 hour. 1 hour downtime. Does it work for the eye bag treatment? Is documented, but not by me. There is something in literature, but are not my works. May I ask what complication you have encountered when using these products? And do this product carry any risk of ischemia or tissue necrosis? No risk. No risk, because there is no BDD inside. So there is not any risk of ischemia or tissue necrosis, because it's not sodium desoxycholate. So we don't have no vascular risk of ischemia, no biochemical risk of ischemia. Nothing. They are, I don't want to say totally safe, because the assumption totally safe is always risky, but I never register any complication. And if you inject in the way that I recommend, very superficial, with the compression, compressing the vessels, you neither achieve swelling and or bleeding or ecchymosis. I usually inject 100, 80 and 100 injection on neck, and I don't and it's very rare that my injection so superficial cause ecchymosis. Rosaria, ciao Rosaria, sempre molto chiaro e completo, grazie Rosy. Moira, ne posso utilizzare su tutto il viso con la tecnica Ponfi per ridurre le nasogeniene? Il lift? Non ho esperienza. I have no experience of lift as filler, because it is not a filler. We should hope that the redensification effect of lift also works on the nasolabial fold. To be honest, is not its true indication. Of course, you can try that, no problem, because You know, nasolabial folds is also a red flag area. So it's a risky area with filler. So if you want to try to regenerate the skin in that area with lift, you can do that. But to be honest, it's not its complete indication. But use it with micropapules on the face, yes, that's the true indication, and you will cause a good a good densification of the matrix. That is the full indication. How much about amount do you inject to treat migration of buccal fat? Well, to be honest, I think that 2 points of 0.2 ml of shape is enough. So the 1 ml of shape on both the side, 0.5 and 0.5, can be enough to provide a result. As I told you, as I told before, as already told, with shape, I suggest to prepare the patient to 4 sessions more than 3 sessions. With lift, 3 sessions are always very satisfactory. With shape, we need a session more. Let's check if there is something else. Risposta fornita, ok. Can you use it? Sara, can you use it on the malar area? What you talk about, Sara? Shape or lift? Please write me down, because if you don't specify, I don't understand. And then, possiamo iniettare shape direttamente nella jaw bag? Yes, exactly, sì. È fatto proprio per quello. Il protocollo shape è specificatamente studiato per la riduzione della jaw bag. Fai 7 punti tutti nella jaw bag da 0,2 su entrambi i lati, 4 sessioni. E vedi che la paziente è contenta. Ora sto aspettando la specifica. I'm waiting for the Sara to specify if she was speaking about shape or lift. And it seems there are no other questions, or there is something more here. Yeah. Which one is better, collagen stimulation? No, this is another method. The face, but cannot guarantee superficial administration. Do you use this technique? No. Which one better, collagen stimulator, PLLA or culture hydroxyapatite, or CELLBOOSTER lift to build collagen? This is a very interesting question. PLLA is a direct collagen stimulator. So let me explain you. I want to be clear. If you want to stimulate to reactivate the physiological turnover of the extracellular matrix and achieve natural results with the natural compactness of the skin and color and tone, use cell booster lift. If you want to achieve an artificial result, and hardness of the skin and fibrosis, use PLLA. I use PLLA when it needs, but if it doesn't, I use cell booster lift. There is probably a kind of patient, 75, 76 years old patient with the surgical indication where it's fine, use PLLA, but don't use it on a 40 years old woman. Don't use it on a situation that can be treated with a physiological stimulation of the replacement of the extracellular matrix. I tell you because it's in the interest of your patients more than you. It's for the health of your patients. I care for my patients. And told this, I don't want to say don't ever, never use PLLA or calcium hydroxyapatite. Do that, but use it when there is true indication. How long after the injection of cell booster shape will see improvement? Also after one session, there is any improvement? Yes. Not with shape, usually not. With shape is very progressive. So you have to start and you will see the first results maybe in some cases after the second session. After the first, it happens, but not very often. Instead, with lift, yes. Lift, you will see the first changes also on the neck, also after the first session. How much amount of do you inject to treat migration of buccal fat? I already replied to this. When treating asymmetric jaw bag or lower face heaviness, how should the injection points and volume distribution of cell booster shape be adjusted? Of course, you have to adjust it. It depends on your patients. I can't, if I don't see the specific patient, it's impossible to reply. To consider that you're playing a game that include 14, 15 injection of 0.2. So in an asymmetric patient, just balance it. You can make 5 injection in a side and 10 injection to another side. Play with that. Doctor, what's the depth of shape to be injected above the sides of nasolabial folds? Laura si sente, tesoro? Laura si sente? Laura si sente? Mi esci un attimo? Sentono? Esci fuori, grazie. Sorry. What's the depth of shape to be injected above the sides of nasolabial folds? Oh, the depth, always the same. About 5-6 millimeters. You have to be in the fat compartment. Poi, grazie Giordano, molto chiaro. Chi è? Brunilde. Ciao Brunilde, grazie a te. Olga, do you recommend combine PLLA and cell booster lift? If yes, what is protocol? No, I don't recommend it. No, I don't recommend it at all. I'm sorry. Okay. Nina, do you agree that we are okay? We replied to everyone?
Yeah, excellent. I think we can close the session.
Okay, so thank you to everyone. I don't know how many you've been, but now I see that you're 90 now. So I think that we had a good interest. So always thank you very much for the participation, and it's always an honor to have your attention, to show the hard work that I do every day to document as much as as much as I can my works to show you how it's still possible to improve skin quality with true biostimulators, biorevitalizers, and not only with collagen boosters. Goodbye and thank you.